Good afternoon, everyone. Thank you for tuning in. My name is Kevin Morrison. I'm the Cook County Commissioner for the 15th District, representing the Northwest Suburbs. I'm really happy to be able to have this conversation with you today. Just a pre-reminder, and thank you for everyone who's tuning in live or who may be watching this recording later. If you have any questions for any of our guests today, please put them in the comments. We'll be able to see them, and we'll be able to get to them as soon as we get to the live discussion portion of the conversation this afternoon. I want to thank you all for joining us. I'm so glad that the organizations such as Kenneth Young Center and Live for Lolly could join me today to discuss an important topic of the opioid epidemic and what is being done in the Northwest suburbs to help those affected. Opioids have ravaged communities across the country, and our local communities are no different. This is truly an epidemic that needs to be approached as a public health crisis. For too long, those experiencing addiction have been stigmatized and ostracized instead of treated with the care and dignity they deserve. This issue is personal to me, as I lost a family member to an opiate addiction. We are so fortunate to be hearing from Shireen Payton and Laura Fry on what their organizations are doing in our communities to raise awareness and share resources. After, we'll be joined by Demetrius and Francis, who will be sharing some of their own stories about recovery. We're also taking questions from the audience, so please, as I said before, drop any questions in the comments, and we'll be happy to get those addressed. To start, I am happy to introduce my friend Shireen Payton with the Kenneth Young Center. Thank you, Shireen, for being with us today.
Thank you. Thank you, Commissioner. Happy to be here. So yes, Kenneth Young Center, we are happy to serve the northwest suburbs with a lot of the recovery support services. This is Recovery Month as we celebrate individuals, the millions of individuals who are in recovery. We have a lot of resources that are available to the community. We have a recovery toolkit that will help you to navigate the systems that are out there, such as for housing support, for education, for connecting you to either medical assistant recovery services. We also provide recovery coaches. We have smart recovery groups for adults, for teens. We also have a smart recovery group for the LGBTQ community. We work with schools as well as organizations who would like to host their own smart recovery groups. We also have a Wellbriety group that is based on Native American traditions and is led by a Native American. It's the White Bison program. We also do naloxone and Narcan training and provide individuals as well as organizations and police departments with the life-saving drug naloxone. And we also provide treatment services at Kenneth Young Center. So we have level 2 treatment services. So if you're looking for individual or group recovery services or treatment services, we have those services available for you as well. We do some partnering with Live for Lolly, our great friends, where we go out into the community, or we can come to you and provide recovery support services, as well as some other wraparound services, including harm reduction services and even rapid HIV testing. So those are some of the things that we offer at Kenneth Young Center.
That is incredible, Shireen. As always, I'm incredibly appreciative of all the work that you're doing for our communities here in the Northwest suburbs, as well as all the work of all the staff at the Kenneth Young Center. Now, I'm happy to introduce another one of my friends, Laura. Thank you so much for being here. Laura's with Live for Lolly, and I pass the mic to you.
Thank you so much, Commissioner Morrison, for asking me to be a part of this. It is so important. Live for Lolly is an organization that's been around for 12 years. We are physically located in Arlington Heights, but we serve the communities of suburban Cook County, DuPage County, McHenry, and Lake counties. We offer comprehensive wraparound services, including treatment navigation. We offer several peer support groups weekly, including brief support. We have peer recovery support specialists on staff, and harm reduction. We have a mobile harm reduction unit called the Stigma Crusher that we take out into communities, and we provide all harm reduction services. And what falls under harm reduction includes abstinence and recovery and treatment and safe supplies so that we don't spread disease. What is really concerning me currently is the large amounts of overdose death rates that we are seeing changing here in Cook County. Substance use disorder is a disease of isolation, and this imposed isolation of the pandemic is making the opioid epidemic 55% worse here in Cook County. I did have some data that I wanted to share. Last year, in July, we saw a total of 605 opioid overdose deaths. This year, same time frame, we had 773 with 580 pending cases that most likely are overdose. This is astronomically devastating. So what I'm hoping to be able to offer here is connection. You are not alone. There are agencies like Kenneth Young, Live for Lolly, and so many other agencies out there that are offering connection. Please reach out.
Thank you, Laura. That was incredibly powerful, and I really appreciate you sharing that. And to our audience, for anyone who has any questions for Shireen or Laura, please put them. We'll be happy to get those as soon as we get to the discussion portion. But I do want to take a minute to talk about mental health. I know we had a conversation that was mental health oriented that we conducted a town hall over the summer during Pride Month, but I just want to get the message out there. There is no shame in asking for help. That is a strength. When you seek guidance, when you seek assistance, when you feel alone or less than, finding support is a strength. And I just want anyone hearing this to know that getting the help that you need will only benefit you and benefit your loved ones. And so it is a strength. And so don't ever be ashamed. I went to therapy myself. I experienced PTSD, and it was the best thing I ever decided to do, because it really helped clear my mind and get me on a better path myself. So it is a strength. And today we have two people with us that are going to be joining to talk about their road of recovery. Shireen, Laura, do either of you want to introduce Demetrius or Francis?
Yes, I can introduce them. So Demetrius and Francis just recently joined the Kenneth Young Center team. They're part of our recovery team, offering the services that I mentioned. And so they're two people who are very passionate about the work that they do. I'm excited for them to be part of the services that we're offering. And so I won't take up any of their time. So I'll just turn it over to who would like to go first.
I'll go first.
Great. Thank you, Francis.
Thank you for that intro, Shireen. So my name's Francis. My pronouns are he, him, and I'm going to be talking about my lived experience. So I have been sober and in recovery from meth and other stimulants since January of 2018. And about my recovery, like I didn't go through like a formal treatment program or like a rehab. And I think it's important to note that recovery is not a one size fits all model, and that it is really specific to everyone, including me. And growing up, like I was in my family environment was, a place where feelings and emotions, especially like negative feelings and emotions, were hardly expressed and never really welcomed. Some of the things I dealt with were like toxic masculinity and homophobia, and family secrets and trauma were big parts of my experience growing up. And it also complicated things, also being queer. It was something that I had to hide because I felt not safe being myself in those spaces, in my own space. Yeah, I feel like my using was something that I had to keep hidden, and then also like my identity, and it just turned into the cycle because it made it easier for me to use. And then also using was how I connected with people from my community too. So it was just like this vicious cycle that I was in, and it was very isolating. And yeah, it was a really hard time in my life. But I think that what really helped me was addressing some family trauma and forgiving my parents about some of the things that I went through. And that was like really the thing that tipped it off and helped me. And I realized too that like it was something that I knew I couldn't keep up. And I was tired of living this lie. So I knew that I needed to change something. So I became sober, and how that looked in the beginning was like I made it hard for me to even use. So I remember at the time I was working like 3 jobs, and I was keeping busy. And there's something that Daryl, my supervisor, he talks about how like the difference between sobriety and recovery is that like recovery is a change in behavior. And I totally believe in that because a change in behavior is like what I needed. I needed recovery. So I need, and one of the things in smart recovery that they teach you is that part of it is a lifestyle change. And I knew that's what I needed. And I knew like that the working the 3 jobs thing wasn't going to be sustainable for me. So I decided to go back to school. I went to the College of DuPage. I found out that they have a CADC, which is a Certified Alcohol Drug Counseling Certificate Program.
Be happy to get those as soon as we get to the discussion portion. But I do want to take a minute.
Whoops. So yeah, I found out that there was this program at COD, and really like the classes were awesome. The faculty was amazing. The environment was just this environment that I wanted to be in, and I felt like I was learning so much about myself and so much about the world of addiction and recovery. And I felt like I was in a space where I could do this, and I can share my story, and I felt comfortable to be able to share my story. And then, when that happened, I went back to working with kids, which is what I was originally doing. And then that gave me some purpose in life again. And then with that, I got health insurance. I was able to see a therapist. And then he really helped me address some of the trauma that I went through, and, kind of pushed me into finding a community that was queer and that was also in recovery. And I was like, I think that's important too. So I searched up smart recovery groups. And then I found an LGBTQ specific group and got in touch with the Kenneth Young Center, and I'm here. So it's, as cliche as it sounds, I believe everything happens for a reason. And, I'm truly grateful for being able to be here and share my story. Because honestly, I wouldn't be here if it wasn't for everything I experienced. So yeah, thank you.
That was incredible. Thank you so much for sharing that, Francis. And Shireen, would you like to introduce Demetrius as well?
Yes, so then Demetrius is another fantastic person who has recently joined our recovery team at Kenneth Young Center. And I just want to point out again, Francis' story just again demonstrates that there are multiple pathways to recovery. So thank you for sharing. I really appreciate that. So Demetrius, would you like to share your story as well?
Sorry about that. All right. Yeah. So my name is Demetrius. Pronouns he, him, his. Similar to Francis, I also didn't take the traditional way when it came to my recovery as well. I suffered from alcoholism right in my early 20s. It was brought on by the passing of my grandmother, who I was very close with. And I recognize that now, that addiction runs through my family in multiple ways. And I was a fool to think that it wouldn't affect me in some way as well. And it was to the point where literally every day I was craving a drink of some kind, or just, getting basically blacked out every day for a good 2 years. And it wasn't until I went away to school, because I wasn't a traditional college student. I went away when I was 23. And it wasn't until then that I was really able to just sit and identify like triggers and identify what really sent me down this road, because I was placed, my university was literally in the middle of nowhere. So I didn't have a car, so I didn't have access to, a liquor store or to like places that were selling alcohol. So I really just had to sit in my own treatment and my own like thoughts and feelings and really work those things out. And it wasn't until, I was in this setting that I was like, I may have had a problem, and I still low key have a problem at that time, because even in the early months of me being away in school, I was like, oh God, I wish I had something stressful at school would happen. It would trigger me like, oh my God, I need to have a drink. But it's like, I don't know where to go to get this. So I really just have to sit in that. Or like if something good happened, like, oh, I would love to celebrate this. I wish I had a drink. And then it was that thinking that I was like, why do I need a drink when something good happens? Or why do I need a drink when something bad happens? And I'm like, okay, I've been affected. And I didn't really talk about it because, just kind of similar to Francis, like my family was not a breeding ground of like secrecy and things like that. Like we didn't really talk about our problems. And if we did, it was kind of like, well, why are you talking about that? Don't share that with nobody. Like that's nobody's business but your own. Or like if you share that with a sibling or something like that. And a lot of that was going on. So I also felt shamed in that, where I was like, how do I even express that I'm going through this with anybody without being ashamed or talked about? And also my sexuality, I was dealing with that as well around the time when I was drinking, and not really sharing that with anybody except my sisters who I'm close with. So it was kind of just the three of us. And I'm the oldest, so I'm the 5 years, and they're like, we can just listen. We can't help you. But just even having that was better than going to people who were supposed to protect you, who are supposed to love you, because they got their own problems, A, or B, they can't get out of themselves to help you because they got their own stuff going on, or they're also dealing with an addiction of their own. So they couldn't help me. So I really had to sit and figure things out on my own. And I did pretty well. I think I did pretty well, but I wish that I would have had, some support, or if I would have had somebody that had gone through it and gotten on the other side successfully, as like a mentor, or as a just a sounding light to just be like, you can get through this. Like, it's going to be hard, in the beginning, it's going to be hard in the moment, but you can get through this. And I kind of didn't have that. So that's why I kind of want to be that for other people who are going through similar things that I went through, but also when it comes to like LGBT, and also when it comes to addiction, because there's a lot of things I had to figure out on my own, but I don't want anybody else to have to do something alone, like how I went through it. So that's kind of what brought me here, and that's what also what's keeping me here.
Right. So it's like, so what you described is the service that you talk about for a recovery coach. And I know, Laura, that's also something that we've talked about with Live for Lolly, is the support of a recovery coach. And some folks may not be familiar with the difference between a sponsor and a recovery coach. So I want to pass that to you, Laura. I know that's not something, we've discussed ahead of time, but in that, you're a little more familiar with, the difference. Do you mind explaining to those who might be listening the difference? Thank you.
Not at all. I am a peer recovery support specialist. I've received formal training to become a peer specialist, and outside of that, we are currently getting certified by the state of Illinois. We have 3 peer recovery support specialists on staff, and what the difference I see, because I've also been through the 12-step program. I'm a person in long-term recovery. And the difference between a sponsor and a peer recovery support specialist is we are trained in all pathways to recovery, or no pathway to recovery. I also did not go to a formal rehab or an IOP or anything. So we are trained in offering compassionate, non-judgmental friendship. You can't be a peer recovery support specialist if you are not a personally impacted person. That's one of the criteria. So we offer non-judgmental friendship, and it's for the duration as long as you want it. So a lot of the relationships that we develop, we have hopefully for lifetime. And the difference between that and like a certified alcohol and drug counselor is we are supposed to be a friend. We're supposed to get together for coffee. We're supposed to offer people rides places. We meet their families. We, engage in life as their touchstone to kind of like what you were saying, Demetrius. Hi, yes, I was where you are. This is where I'm at now. You can get here, and I'm your friend.
Thank you.
And thank you for bringing up that question, Shireen. It's incredibly important. And Francis, Demetrius, I can't thank you enough for sharing your personal stories. They were incredibly moving. And they're impactful. When you share your lived experience, it is incredibly impactful, especially to those who either are personally dealing with similar trauma or addiction, or who have loved ones who are doing so as well. And I want to share a story, and thankfully Majority Leader Greg Harris has been open and upfront about this. But in the state of Illinois, the second highest role in our Illinois legislature, the Majority Leader of the State House, is a person in recovery and is a former addict himself. And he was able to find sobriety and has now become such an incredibly impactful leader here in the state of Illinois, really pushing our state in a better direction. And so once you are able to find the route that works for you on your path to recovery, there are no bounds or limits to what dreams could actually become a reality. And so I think that's an important example right here at home to bring forward. I do want to start with a couple questions, but just a reminder, anyone watching this live conversation, if you have any questions, please put them in the live comments. We'll be happy to get to them. First, this is a question for Shireen and Laura. How has the COVID-19 pandemic changed outreach for prevention programs and the path to recovery? I'll start with you, Shireen.
Yes. So one way that it has impacted prevention outreach, so what we had previously done is that we had gone into schools, like on the prevention end, we would go into schools with evidence-based prevention programming, such as Too Good for Drugs, and another type of life skills program where we would go in for, like, say, 10 to 14 sessions and deliver them live in schools in cooperation with school administration and teachers. And so now our prevention team, which is led by Michelle Barron and her amazing staff, what they're doing is they're recording those sessions. They're working with the curriculum developer to figure out how to record these prevention education sessions, and then the e-learners can then view them via whatever platform, Schoology or whatever it is that they use, in order to get their prevention education. And it's a little bit challenging because, of course, as schools are trying to figure out how to do their e-learning, they're also trying to figure out how to continue those collaborations with organizations such as Kenneth Young Center in implementing youth prevention education. So that's one way that we've adapted our prevention work. Our Youth Advocates for Change, or YAC, or our Youth Advisory Councils, they've taken their prevention work online. So they meet via Zoom. They do a lot of their efforts via Zoom, and then when they can meet in person and socially distance in an outdoor venue, they'll do their work in that manner. Daryl Pass, who's the manager of our recovery programs, is in the process of, he's already recorded his naloxone training online. And so we're in the process of editing that video so that people can go through the training, and then we will be able to ship or drop off their Narcan. We had planned on doing a 2-day conference for Recovery Month, but we turned it into Webinar Wednesdays in collaboration with Live for Lolly and Elk Grove Village Cares. And so we've had our Webinar Wednesdays. We have one tomorrow night, our final one, started at 6 p.m. So those are just some of the different ways, and it's been really well received. I think people have been adapting in the same way that we've had to adapt the rest of our lives, so it's been going well. I think we've learned a lot, and we've just been able to make the adjustments along the way. Our organization has Kenneth Young Center was just, we were set up in a way that we were ready to take on the challenge, fortunately. So we just were able to get right on board with all of the online platforms for everything. So that's what we've been doing.
That's really great to hear, and I'm glad to hear that the great work of Kenneth Young Center continues. And this town hall is just another example of ways that we could change. And I feel that when we had in-person town halls, we had, there was a less ability for people to be able to fit in that time slot to come and be present at that event. And now I feel like we are reaching such a broader audience. And so there are some benefits to utilizing new technologies and types of outreach. So I'm glad things are going well with you and Kenneth Young. Laura, how has COVID-19 impacted Live for Lolly? What changes have been implemented, and how are things going?
I agree with you, Commissioner, about going virtual, opening up a lot of doors. We went virtual with our peer support meetings at the end of March when the governor shut the state down, and we've seen people fall off, but we've also seen people who used to come to our in-person meetings and move away come back into the fold and reconnect with the people that they used to go to meetings with. We have out here in Arlington Heights with no public transportation or very little. It is sometimes difficult for people to get into the meetings. So now this removes that barrier of transportation, which is really awesome. But our meetings are down in attendance from in person. We are going to start a marketing campaign the month of October to try to encourage people to connect and to reconnect. I seem to, just while I've been on this town hall, I have gotten text messages from 2 people with overdosing family members, just in the short amount of time that we've been here together. People just need to stay connected. The other part that we had to make some changes to was our mobile outreach. Our mobile outreach launched on March 2nd, and we had to stop at the end of March because we didn't want to bring crowds of people together. However, we have been very, very busy doing either mailing deliveries of safe supplies in naloxone or door drops. We're doing about 40 to 60 a week of deliveries. So we are available for delivery within driving of all supplies and naloxone. We'll do all trainings online. We also, the month of April, got certified in 5 of our education programs to be able to offer CEUs. So we do have 5 training programs that are certified through IODAPCA that we can offer CEUs, just trying to, again, keep people connected and keep people educated. So I think that we've adjusted pretty well, but I think we need to find some way to get people out of isolation while having to be isolated, if that makes sense.
No, that does. It does. And I think the latest data I saw was if you're socially distant outside and you're wearing a mask, it lowers the chances of being able to either pass on or become infected with COVID. I think it's 1/17 as likely if you're social distance outside and wearing a mask. And so, there are ways to safely gather. Just make sure that you're wearing a space, you're keeping socially distanced, you're not shaking hands, you're washing your hands, you're not touching your face. There's ways, I live by Bussy Woods, and so when I'm feeling cooped up in my house and I need to get outside and I need fresh air, there are some pathways through many of our incredible forest preserves, where especially right now in the fall, seeing the leaves change colors, that is some self-healing right there too. So it's not I recommend everyone get some fresh air these days. But we have a comment that I'm going to turn into a question for Shireen. Michelle said, yes, we need to do more prevention, teach our children about the realities of experimenting with drugs. I know you were mentioning going into schools. Has there been work or any success in talking with any of the school districts that Kenneth Young covers in terms of maybe joining in on a virtual lesson for many of the schools that are, just utilizing online learning right now? Or is there a plan for that in the future?
Yes. So we have some schools that have signed up, but there are a few schools that, due to their schedules or just trying to catch up with the hybrid model that they're implementing. But, with our state grants, it is free and available to any of the schools that are in our service area. So in the northwest suburbs, so any schools that are in the Palatine, Schaumburg, Elk Grove Township areas, the Hanover Township area, we are available to any of those schools. So if they want to reach out to us at the prevention department and contact us, we can connect them with, I'll connect them with our prevention manager, and we can get those services available where they can do the online learning, or once they're in person, we can also provide those services. Again, they're evidence-based prevention education programs, as well as youth advocates for change or youth advisory council group meetings that youth would be able to participate in for prevention work. We're also doing, we also have communication campaigns, the way that Laura mentioned, where we talk about the majority of youth do not use substances, also encouraging parents to have those conversations with their kids about not using substances. We're asking parents to, start, now with COVID, now's a great time to have those critical conversations about setting expectations of not using substances, and also just keeping an open communication with them.
Amazing. No, thank you, Shireen, for sharing that. And, this is a question that I'm going to share with everyone. You can go as long as short as you would like in sharing this message. But for those having trouble asking for help, what would you like to say to them? And I'll start with Demetrius.
Sorry. I would say that I'm one of them, that I have a problem asking for help. It's not as bad as it used to be. I would just say really, because sometimes you can be your biggest roadblock. So I would say really get out of your own way, and know that it's not, I mean, it is a pride thing, but it's not a sign of weakness. I know you said it earlier, like it is a sign of strength, and it is, it's okay to ask people for help. You won't appear weak. There's things out there that even though our toolbox may be full, this obstacle, this problem, it might not be something that we have, the proper wrench for, or I don't know anything about tools, as you can see. I only know wrenches, wrenches and flatheads. But you may not have. You might need a saw for it, and all you got is some hair scissors. So it's okay. It's okay to ask for help in any situation, and know that you look stronger asking than trying to carry this by yourself, and then it's like. And then failing, because then you have to deal with that on the flip side. So I would say always, if you have the opportunity, always ask for help, because it's better a fist than single fingers. You guys get that mod. I don't know how it goes.
Oh, beautiful. That's beautiful. Thank you for that. And thank you for bringing some laughter. I also don't know much about tools.
Right.
My desk chair has not been fixed yet. I know
I don't know anything.
Oh my God. Francis, what would you like to share?
Well, like Demetrius and Commissioner Morrison, I also don't know much about tools. But I would say definitely, like, you don't know who you might connect with and what that connection will look like. I know for me, I also was someone who, I'm very independent, and it was hard for me to ask for help. But I think in doing that, there are some meaningful experiences waiting out there for you that you just don't know about.
Thank you so much for that. I appreciate it. And then we'll go to you, Laura.
I really like what you said, Francis. In this time of isolation, we are all suffering. So when you reach out to me for help, we're helping each other. And we all need that. You are not alone. You are not the only one that feels isolated or needs a hand up. So let's connect and help each other through this.
Amazing. Thank you for that. And Shireen?
Yeah, I think that's one of the reasons why we have our Toolkit grant, our recovery toolkit, is that sometimes you don't know what you need, honestly. And that's the whole purpose of a toolbox. Let me help you out here, Demetrius. So there are multiple tools that you can, try out to see, is this the one? Is this what I need? You don't know. But I think that if you reach out to us, reach out to Kenneth Young Center, reach out to Live for Lolly. If we don't have the answer, chances are we can connect you with someone who does. We have a community coalition, the Communities for Positive Youth Development. Although it's youth development, but youth, it expands across the ages. The programs that we serve within our division and within Kenneth Young Center, we serve from age, we say 3 to 103, I think, or 107 or whatever. The point is everyone. But we can connect you to someone or to the services that you need. So if you just reach out, again, whoever answers the phone may not have the direct answer for you, but we will be able to connect you to someone who has the answer, so that we can pretty much guarantee that will happen. So reach out to us and we will find an answer for you.
That is amazing. And I feel like everyone was looking at the next question I had prepared on the conversation of tools. But I do want to show and just remind folks who are watching this live, if you have any questions, please put them in the comments and we'll happy to get them addressed. But the next question I have, and I'm going to direct it right back to Shireen, what recovery tool are you most optimistic about?
Which I would have to say our toolkit. It's online at kennethyoung.org. So I'd say that's probably our number one, is that toolkit. One of our staff members, Krupa Patel, put it together, and it's been working on it for over a year now, or almost a year. And it's amazing. All of the resources that are on there, there are podcasts, there are, I'm a little bit of a research geek, so I get excited about research. Not everyone else does, but there's research on there. But there's also presentations. There's you have webinars. But so the toolkit just has a lot of resources on there. So if you connect with our team, we can get you connected with the toolkit as part of your recovery process. And then we have incentives for folks who use it as part of their opioid use disorder recovery process. So contact us about that toolkit. I'd say that's the tool that I'm most excited about. And then second, I'd have to say is naloxone, which I'm sure Laura would also talk about.
That's amazing.
Too.
Hey, it's okay to choose two. That's amazing. Thank you. And Laura, what tool are you most optimistic about? What do you think works well?
I don't know. I'm not feeling very optimistic, but I'll try. I think having a peer recovery coach as your one-on-one is very important. Also attending some type of peer support meeting, whether it's Smart Recovery, Celebrate Recovery, AANA, just being able to commune and communicate with people that might be further along than you or not as far as along as you, to be able to be a beacon to someone else when you're struggling is healing. So peer support, recovery coaching, and I really like Kenneth Young's toolbox. So I have to say that.
Amazing. Oh, I wish I could share some of my optimism and my energy with you, Laura. I'm sending you a big air hug. I know that you had some tough information shared with you since we entered into this conversation today. I tell people that I'm trying to keep positive. Each day I try to focus on what are the few good things that are going on. But I tell you what is the most beneficial, especially for you out there who might feel like everything is going wrong right now, or you see stressors with the craziness we see in the news every day. What I try to do is what makes me aggravated, what disappoints me about our current situation. I try to focus as much of my energy to what I can do to help change that. So What could I do to change, if something in government's aggravating me? What could I do to ensure that we are seeing more affordable access to mental health care in the county? And I focus as much of my energy towards changing whatever disappoints me. And, volunteering is a great way to fill that hole too. And so I'm sending you some of my positive energy virtually right now, Laura.
Well, and just seeing faces like Demetrius and Francis and having them share their story, we do recover. We do. And, that's part of what you get when you attend a peer support meeting is you see that people do recover. It is possible. So both of your stories meant so much to me today. I thank you.
I agree. I agree. Incredibly moving, I tell you. Sharing your personal story is incredibly impactful. I actually had a phone call with a family friend yesterday, and I shared one of my traumas in my youth, and they opened up to me and shared one of their traumas as well. And it's a way of self-healing, being able to open up and talk about your lived reality with others. You will really be surprised with what they share in return and how beneficial you feel afterward. Because not only do you feel, that you were trustworthy and worthy to have them share in return their lived reality, but you recognize that when you finish that conversation that you both benefited from it. Now, I want to ask Laura, what messaging seems to resonate with youth in regards to awareness and substance use prevention?
That no one is immune to substance use disorder. It hits every demographic, every race, every community, every neighborhood, every socioeconomic area. It does not discriminate. So I think that's a really big message. And I'm hoping that message, knowing that it doesn't discriminate, removes some of the stigma that some people might have against those who suffer from substance use disorder. It is a disease that hijacks the brain. And everybody knows somebody. 1 in 3 people have been impacted. So instead of judging and stigmatizing those people with the disease, let's join together and help them get better.
I love that. And if that is any message for Recovery Month, we must do all we can. If we are supporters, if we have that lived experience, whatever we can do to get the message out there to end the stigma is crucial. And I couldn't agree with you more. And Shireen, I would like to share the same question with you. What messaging do you think resonates the most and has the biggest impact?
I have to agree with Laura. I think it's the same thing. I would have to say is that it's understand that it is not a character flaw. It's not a failure. It's, the stigma is our biggest, our greatest issue. When some people say, what's our greatest challenge in fighting the opioid crisis? And sometimes people want to demonize and say it's the pharmacist, it's the economy, it's, they want to name all these different things. And I honestly think it's stigma. I think if we could get rid of stigma, we would make such great strides in recovery. So it's not a character flaw. It doesn't mean that you're a quote bad kid or a bad seed or whatever. So I think that's the one thing. I think you can sort of see when you say that to a young person, you see like this, just this weight lift from their shoulders because, it's what they've been telling themselves, is what they've been hearing from others, from family members, is the voices in their heads about it. And it's just simply not true. It's just not true. So just understand that. And also understand as part of that too, is that there are multiple pathways to recovery. And that we're here to help you with that. Whatever your path is, we're here to help you on that pathway. whatever you do.
Shireen, that was beautiful and incredibly well said, and I thank you for sharing that. And it is so true. We must end the stigma. We must share that asking for help is a strength. And yes, there are many different paths. There's rehab options. There's group therapy settings. There's talking with other individuals who are on the path to recovery. There's so many resources available, and it's just important that if you're ready to take that step, to reach out to organizations like Kenneth Young or Live for Lolly, and there are people who will help you on that path to recovery. And I look at it. I've had a couple conversations recently, especially with some of the things going on the national level when it comes for like what is pro-life. And in my mind, I think what pro-life is actually bringing affordable access to healthcare, bringing affordable access to mental health care resources, equity in education. It should not matter what zip code you live in. You should get the same top of the line education in the United States of America. I think that everyone should have access to a living wage and a job that will actually support them and bring them out of poverty. That is what actually is pro-life, and that will help many of the issues from people who struggle with addiction or mental health issues or have considered or attempted suicide. These all are contributing factors, and we need to work. And as myself as a county commissioner, I'm working on trying to fix those issues with my voice, but we could all do our part in trying to end stigma as well. And now we have a pertinent question too about someone who has a lot of monetary resources and what they could actually do to have a huge impact. And I'm going to start with you, Shireen. What can drug companies do today, tomorrow, and in the weeks and months ahead to help stem and have a positive effect on the opiate epidemic we're experiencing?
Well, I appreciate any company that take, the altruistic approach to anything that they do, just recognizing the impact of the work or the product that they put out there to reduce as much harm as they possibly can. And then also to contribute to the communities that are impacted by the work that they're doing. So I think that's what any company should do. It's challenging because we live in a very capitalistic society, but I think that giving back to the communities that you are making dollars from is the best thing that you can do. Employ folks from the community and then also provide funding to communities and try to do as little harm as possible. Because it's hard to ask people not to do no harm whatsoever. It's very hard to ask. But those are some things that one could do, that the pharmaceutical companies could do. They put all the research into it. They know what they're doing. So, yeah.
Oh, thank you for that. Laura, what would you like to shout out to the drug companies and what they could do better? You're muted.
Not only the drug companies, but the medical community. I come from an ER medicine background, and I would like to see the pharmaceutical companies and the medical field better educate patients. Time and again, I had patients not realize that opioids work in the brain. They do not work at the site of injury. Why aren't we telling people this? We are not giving people the tools to make the decision for themselves what their needs should look like. So I want to see pharmaceutical companies be more openly educating people. And I think that's a big thing.
Oh, that's incredibly important. I think we need better warning labels, and hopefully our federal government and Congress will hopefully implement better policy changes down the road. I remember when I had my first knee surgery, I was prescribed Vicodin, and I was not told that Vicodin was addictive or that I might have any ill effects. And I remember that when I was in recovery from that knee surgery, it made me incredibly angry. And so after a day and a half, I had to stop taking the drug altogether, and it scared me. And I guess that was a fortunate experience for me that I realized I had an ill effect immediately, but I don't feel like I was given a proper warning back then, and that was in 2007. Now, I just want to share my appreciation with all four of you and the work that you're all doing to inspire and have a positive impact in our communities. It is Recovery Month, and I'm grateful that we are able to have this conversation today. I do want to go around the horn one last time. If there's any last thoughts, comments, words of advice that you would want to share to help end the conversation today. And I will start first with Demetrius. Or do you want me to start? Back to you.
Oh, well, I'm here. I would say, like, I guess the slogan, like, if you or anyone you know, just talk to them, see where their head's at when it comes to it. You don't want to push anybody to do anything that they don't want to do. But just, talk to yourself, talk to them, and just, know that the resources are out there. All you have to do is look for them.
Thank you so much. I really appreciate, Demetrius, you being here with us today. Francis, any last comments, words of advice, anything you want to share before we end the show tonight?
Sure. Maybe just that there is help out there for everyone. And again, like what I said earlier, recovery is not a one-size-fits-all thing. And there's help out there for you. Just got to be open to it.
Thank you so much. I really appreciate it. Both of you sharing your stories today have really left a big impact on me personally, and so I hope they're viewed far and wide on the interwebs and have an impact on others as well. And Laura with Live for Lolly, any last words?
Just remember you're not alone. Reach out. If you are going to use substances, be sure that you have naloxone. Be sure that you are not using alone, and test your supply. And we have all those supplies for you.
Bless you, and thank you so much for the work that you're doing, Laura. I look forward to when we're able to get back together in person again.
I know.
Soon in the future. And please tell everyone at Live for Lolly I said hello and share my well wishes. Shireen,
Thank you.
and thank you. No, of course, and thank you.
So lastly, I would say we haven't really touched on this, but a part of my recovery story is just understanding that the family members who are impacted by family members who are in recovery, we're also there to help you all in that process. There's Smart Recovery for family members. So we're there for you as well. So we're all in this together. So we're there for you too.
Oh, that's a great way to end off. And I just want to share my appreciation with you for today and sharing your stories and sharing the resources that are available. There are resources to help. And so there's no shame in asking for help. There's only strength. Thank you.
Thank you.